and welcome to Hallam Medical's Chief Nurse podcast. I'm really excited today to have a very good friend of mine with me, Sarah Fisher. Sarah, do you want to introduce yourself and tell people a bit about what you do?
Yeah, of course. And thank you, Lisa, for inviting me to come on to this show with you today. It's super exciting. So I'm Sarah Fisher, and I'm the professional lead for advancing practice and the deputy nurse of our social care nursing workforce here at South Yorkshire ICB. Now, I've been a nurse for 25 odd years, and I've worked as an advanced clinical practitioner for probably about 18 or 19 years of that time. And primarily the roles that I've been in the areas have been primary care GP practice, urgent care centres, walk-in centres, worked in the A&Es. So I've got quite a varied experience, which has been really instrumental to me taking on the role of the professional lead, which I've been in post for now for approximately 5 years.
Oh God, that makes us sound old, Sarah, when we
I
say all
know.
those years that we've been nursing.
It does. It makes me feel terribly old, and I think, but where has time gone? It absolutely flies by, and all of a sudden you think, I was only a student nurse what felt like 2 minutes ago, and I feel like I'm 18 years old, but I'm obviously not.
We're still 18 years old in our head. That's what we need to
Exactly.
remember. So can you tell us a bit about the history of advanced practice in South Yorkshire? Because it does very much vary, doesn't it, around the country
Yeah.
as to what pathway people have taken with advanced practice.
Yeah, absolutely. And in South Yorkshire, we have been really lucky in that we've had a good history and great support from colleagues across our area in developing advanced practice. So we'll go back to about 2015, when most of you might know this name, Julie Perry. She was a nurse consultant at Sheffield Teaching Hospitals, and she founded the South Yorkshire Faculty of Advanced Practice with Dr. Simon Clark, who's a neonatologist still at STH to this day. And they received some funding from Health Education England, as it was then, to set up this faculty. And it was the first local faculty within England. So from day one, the area has been very forward thinking in how we support and develop our workforce, how we maximise access for patients to healthcare so that they're getting appropriate treatment, timely manner by the right person. So that's where it all began. And they identified really quite early on that, as I'm sure none of you probably would disagree, that advanced practice developed in the hospitals much sooner than other areas. And also, just due to the logistics of a hospital, for example, the support is much more present. And we found that colleagues working in other areas such as primary care, community, mental health, really struggled to access training, but then also to complete it with the support. And the understanding of the role of the advanced practitioner really wasn't there. And to this day, to some extent, providers still struggle to understand, well, what is an ACP or is an AP? What are we even calling it these days? And just to go back a bit in time again, showing my age, when I first started doing this kind of work, which was 2002, I think it was. 2004, something thereabouts. Anyway, we were called nurse practitioners or minor illness nurses, and the title has changed, and it's not always reflected the role and the complexity of patients that we actually see. So they started a project putting in extra support. They had a GP on board where they were delivering education sessions. They started bringing in more paediatric training, because many of you will probably know that paediatrics is something that didn't feature very much in the masters. And the masters back then as well was known as the Advanced Professional Practice course, not ACP as we know it today. So we've had a lot of changes over the last 10 years or so, and that programme was really successful. So I came into this 5 years ago initially as the primary care lead to continue to deliver and support on that work. And then not long after that was when we had the formation of the regional faculties of advanced practice. And naturally, Julie went up to head that. So within our North East Yorkshire region, we've got 4 areas, which now are known as the 4 ICBs. So we have South Yorkshire, West Yorkshire, Humber and North Yorkshire, and North East North Cumbria. So for a while, we had advanced practice leads in all four of those areas. And then HEE went through the change process with NHS England, and that's when they merged. So also that was the time that ICBs were coming into play as well. So
Yeah.
we were fortunate in South Yorkshire that we've got a team already set up to carry on leading on this, and that at that time was myself, because I took over from Julie as professional lead. So for the last 4 years, we have continued to develop and improve on what we offer. So we expanded the support programme from just primary care, community and mental health to all advanced practitioners, regardless of what clinical area that they work in. We continue with the paediatric training. We offer clinical supervision, one-to-one support, and we've done lots of work with all our organisations around the need for portfolios to evidence our competency, but in a supportive measure as well. And I think that's really, really important that our advanced practice workforce know that everything is in place to support them, keep them safe and the patient safe. And competence is obviously mega important, but equally having the confidence and feeling comfortable in yourself and your decisions, because a lot of patients out there are very complex, as you know. So we do a lot to support the workforce as well from a pastoral perspective. And we've had a couple of evaluations done on that programme, which has demonstrated clear success from the work that we've been delivering. So now we're rooted within the ICB. So we have that voice straight to our chief executive nurse and our medical director, and we can keep waving the banner for advanced practice. Look at the difference that we're making to the workforce. So we have come on in leaps and bounds over the last years, and I'm really pleased and proud to say that I think we've made a substantial difference, and that we've got fantastic advanced practice leads throughout our area who are all of the same mindset and just striving for that best practice.
Yeah, I think as an outsider looking in, I think what you guys have achieved is amazing. As you know, my career pathway started very differently because I was Sheffield Teaching Hospitals first AMP, but I was
Yeah,
a critical care cardiac AMP. So I very much experienced that nurturing support. Bit of a weird job again in the early days when we were just kind of making it up as we went along, because I was an advanced nurse practitioner stroke matron. So I had two hats on at that
yeah,
time. But it was early days when we were feeling our way. And then I think I was quite shocked because I'd been very secondary care, but then came into the world of primary and community care. And I think I was quite shocked about just how much of a different experience and support my colleagues had had in primary care compared to what I'd experienced in secondary
yeah.
care. So I think it's absolutely amazing work that you guys have done to bring that up to on a par with what other colleagues get in a different sector of healthcare. So I think, yeah, you should all be really proud of yourself because you've done a really, really great job.
Oh, thank
What
you.
do you think? What do you think the future looks like now for advanced practice?
Well, to sum it up in one word, bright. I think we've got a real good opportunity for advanced practice to keep going from strength to strength, like it has done over the last 10 years. Do you know, we are a really recognisable and valuable workforce, and the services that we offer to our patients is just phenomenal. And I was so pleased to see that advanced practice is now featured in the 10-year health plan. So we can only continue to go from strength to strength. And not only do we think about our NHS organisations, we need to think about alternatives. So we have got advanced practitioners in our prison service. You know, I went and spent some time with them and I was absolutely gobsmacked. I thought I worked in an isolated area in primary care. My God, it was nothing compared to what these people deal with. Absolutely amazing. Take me hat off to them. But we're now advanced practitioners in our hospices as well. And we're branching out into social care. We're also looking that, I mean, we all know that this is multi-professional, but primarily, and the majority are nurses, but AHPs as well. There's a full range of them who make an absolute massive contribution, and we need to make sure that we're reflecting that in our workforce and how we're delivering. We talk about NHS and non-NHS, we talk about health, we talk about social care. But at the end of the day, are we not arguably one workforce? We're all looking after patients. We've all got the same intended outcomes to provide absolutely the best and safe care that we can. And, you know, there's enough work to go around. There's enough patients.
Absolutely.
So I think, you know, things can only get better for advanced practitioners as long as we have the supervision and the governance in place to support. I think it's absolutely amazing. And personally, from my own clinical experience, we see the same regular patients, and when they come in and say, thank you, if it worked for you, I wouldn't have had my cancer diagnosis and I wouldn't be sat here now treated and well. Nothing beats that feeling. And I'm sure everybody resonates with that.
And that's all worth those really hard nights, writing those dissertations, practicing those examinations, and all that we've done. And I think it's really important that you've mentioned other colleagues that are non-nursing, because what they offer as advanced practitioner as well is amazing. As you know, at Hallam we have lots of paramedics and physios and multi-professional people working in advanced practice. And I think there's a big narrative to be done there, isn't there, with the public as well, about how all those other professions feed in to that wealth of knowledge and experience, and how we can learn from each other, you know, because we might both see the same patient and highlight very different elements of what that patient needs. So I think that's really important. So that's great to hear. So the big subject for us all at the minute, Sarah, is the 10-year plan.
Yay!
We're all cheering for it.
Yeah.
And obviously there are the 3 big shifts that have been identified. That are there any particular innovations that are happening to support this change in working?
Yeah, absolutely. And I think, just to reiterate again, you know, the 10-year plan is really clear about what we need to do, that we need to carry on with continuing to support, increase our advanced practice workforce. But what we also need to do is think about reforming the way that we're working as well. And I think that's where we're doing quite well with the innovation in South Yorkshire, reforming and expanding the work that we're doing. For any of you who have not seen what the 3 big shifts are, this is about care going from hospital to community, from treatment to prevention, and analogue to digital. So 3 massive areas. But is any of it rocket science? I don't think it is, if I'm quite honest. But particularly here in South Yorkshire, we've always been horizon scanning. We're always thinking about what else can we do? What can we make a difference? Where do we need more advanced practitioners? Where are the waiting lists high? Where are the treatments needed? So in actual fact, we have just started a 12-month pilot project where we have positioned an advanced practitioner in a nursing home. So just to give a little bit of background to this, I wrote my dissertation. I did a literature review looking at the impact on patients when care is delivered by an advanced practitioner for residents living in a care home compared to other models such as GP going out, community matron going out. And that actually came from my own personal experience of when I used to go into the local care home and do my weekly ward round. And I'll be honest, it was really hard. You know, the residents would change, the care staff would change, and you couldn't always get accurate histories. There was always conflicting information, which I know you can get that in all areas, but it just felt difficult because you didn't have that same continuity and you weren't able to deliver personalised care because in a 1 or 2 hour visit per week, you just didn't get the opportunity. And I just thought to myself at that point, if only they had their own advanced practitioner who knew those residents inside out, like we know our own families. We often know when they're ill and starting to deteriorate before any vital signs start going off. And my literature review demonstrated that really clearly. There was a reduction in 999 calls, patient outcomes such as blood pressure, for example, they were improved. There was de-prescribing, so that made patients better. They weren't having medications that they weren't needing to. And there's no denying cost-efficient resource using advanced practice. So I was determined I wanted to prove this here locally in the UK. So my wonderful colleague, Nicola Bindley, she's in this care home now. And in week 1, already we've seen a reduction in the need for contacting GPs and improvement in patient care. So this project is going to carry on until December 2026, which then we will write it up and evaluate it. So I'm really excited about that, and I really want to show that this is something that we can scale up and that actually we're missing a trick. We have all these really, really experienced nurses and paramedics, physios, pharmacists who all can be contributing to looking after patients in care homes, which reduces the burden on primary care. It reduces the amount of 999 calls, the amount of hospital admissions, and we're looking after people in their own home. They don't need to go into hospital to get the care that they need. We have that experience there. We need to be using it. And I'm really pushing for that. And that also speaks really loudly in support of our nursing colleagues who work in social care, that they're going to get the opportunity for career development and to lead into advanced practice as well. So I'm really passionate about supporting that.
And the quality of care, Sarah, as well. As you say, in a 1 hour, 2 hour visit,
Yeah.
let's be really realistic. You're troubleshooting, aren't you, rather than
Yeah.
personalising care, because that's all you've got the time for. And I know I personally got involved with you with this project at the start, and it's really exciting and really passionate. And I suppose the other thing that's nice to mention is we were able to use our involvement as Queen's nurses to get our heads
Exactly.
together and
Yeah.
get some more senior support and getting it talked about on a much senior level.
Yes.
So it was great to use those titles that we worked really hard to get
Yeah.
to try and push and improve patient care, which is what it should all be about.
Absolutely.
So you need to keep me updated on that because it all sounds really, really exciting.
Well, I absolutely will. And I think let's just make a plug for the Queen's Institute of Community Nursing, because just one thing to add, the nursing home that I'm working with is also run by a Queen's nurse who I met through our Yorkshire and Humber QICN meeting. So networking and relationships are so important in driving positive change. So I would advocate anybody to look at that. And I'm apologising now to our AHP colleagues and our paramedics and pharmacists that they're not nurses. We need to have a Queen's Institute for Community AHPs. Now, there's an idea.
Yeah, there is an idea, and you know, it does give us the chance to get some really serious things on the agenda, doesn't it?
Yeah,
I know
exactly.
you and I discussed recently how I was lucky enough to go to the House of Lords
Mm,
to talk about the future of district nursing and the challenges we've got in district nursing at the minute, and to really be present in that discussion and try and feed in to those really influential people in the room that can hopefully try and help us address some of these shortcomings so that we can move to the model we want and patients can receive their care closer to home and in
yeah.
an environment that's more important to them. So absolutely second you in that plug for the QICM because they do some amazing work there. So what support do you offer in South Yorkshire? What makes it a bit different in South Yorkshire, Sarah, for our advanced practice colleagues?
I think by the fact that we've had a dedicated team to supporting our colleagues, and that also we've created this community of practice, a network to link all of our advanced practice teams together so that they know that, oh, I've got a problem with this. I know who to contact, so that they can get that support easily and at hand. And I think that makes a massive difference to morale and efficiency within the workforce as well. But like I said earlier, we've been delivering online education sessions, network days, clinical supervision. We are going through a period of change within the ICB.
Yeah.
So some of those may not be able to continue. However, we've still got a website that's live and running at the moment where all our education sessions can be accessed for free. We've lots of useful resources on there as well. And I'm still here as a point of contact. And I'm always really happy for anybody to contact with me about anything to do with advanced practice or any support, because, you know, we're here for each other. So I'm happy to share my email address with anybody that would like it.
No, that's lovely. And I can personally speak to the education sessions. I think they've been fantastic. I think the fact that you can access them as and when really
Yeah,
helps because we can't always be free as clinicians at a certain
exactly.
time on a certain day. So it's been absolutely fantastic. And I've really enjoyed engaging in all of those sessions. So Sarah, thank you so much for joining me. I hope we've got a little bit of a way to shining a light on the advanced practice world and celebrating it
Yes.
as it should be celebrated. And it's really lovely to have you with me.
Oh, well, thank you ever so much, Lisa. I've loved having our chat today. And it's good luck to everybody in the future for advanced practice, and continue to celebrate, as you quite rightly said.
Absolutely. Thanks a lot, Sarah.
Thank you.